The quality of racetrack medicine was not the only reason that I decided during my internship that I could not make a career as a racetrack veterinarian. These horses are immature juveniles. A 2-year-old horse is equivalent to a 6-year-old human. A 3-year-old horse is equivalent to a 9-year-old human. Yet the biggest races, including the Triple Crown, are for 3-year-olds. They still have their baby teeth, their bones are not mature, their brains are not mature. These juveniles are herded out to the racetrack for less than 30 minutes of exercise per day. Then these juveniles spend the rest of the day standing in a 12-foot by 12-foot stall. A 12 by 12 stall for a 1,000-pound horse is equivalent to a 4-foot by 4-foot closet for a 100-pound child. Most of these juveniles never see pasture or a moment of playtime once they start their racing career. The beneficial effects of regular activity throughout the day is well documented in juvenile humans and juvenile horses. Constant exercise makes bones, ligaments, and tendons stronger. What impact would 23½ hours of standing in a closet have on the bone strength of a child? What impact would 23½ hours of standing in a closet have on the mental health of a child? These stresses on these juveniles leads to lifelong issues. These lifelong issues of the juvenile racehorse is often where my care comes into practice. The overwhelming majority of my patients are between 5 years old and 25 years old. The owners of my patients want their horses to be comfortable and serviceable throughout their life. The quick fix has no place in my patients' lives. The juvenile racehorse comes off the track with stomach ulcers from the stress of their work and environment. These juvenile racehorses also leave the track with tendon and ligament injuries, which severely impact their comfort and value, as these injuries often dog them throughout their lives when they re-injure them over and over again. These juvenile racehorses often have evidence of osteoarthritis, even at the ripe old age of 4 years old. Some of the arthritis is from straight wear and tear. The rest of the arthritis is from chronic, repetitive, and excessive joint injections with corticosteroids. Many other horse sports prohibit exhibition of horses younger than 4 years old. These juvenile racehorses also often have been mentally stressed to the point where many boarding facilities do not accept thoroughbred as boarders because they are considered dangerous or wild.